Hello, everybody. This is Dr. Kamel again, and medical terminology number 8. So, Bemphus vulgaris is type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction. IgG autoantibodies form against dysmoglin 1 and 3 in desmosomes. Separation of keratinocytes in stratum spongiosum from stratum basale, and positive Nikolsky sign. Bullous pemphigoid is type 2, also hypersensitivity reaction. IgG autoantibodies against hemidesmosome. So here, this is against, desmogillin 1 and 3 in desmosomes, and this is against hemidesmosomes. Separation of epidermis from the dermis and negative Nikolsky sign. Okay. Spina bifida occulta, meningiocele, myelomeningiocele, and myelochasis. Failure of caudal neuropore to fuse by 4th week of development, and it is caudal neuro. Anencephaly, encephaly, failure of rostral neuropore to close. So failure of caudal, which is, caudal is towards the end of the body, will give spina bifida. Anencephaly is failure of rostral neuropore to close. No forebrain and open calvaria. Hollow brosencephaly, failure of the forebrain brosencephalon to divide into two cerebral hemispheres. We have right and left cerebral hemisphere, but now there's failure to this to happen, to divide. Developmental field defect typically occurring at weeks 3 to 4 of development associated with SHH mutation. We can look at what is SHH mutation. Trying to check what is that. So SHH mutation. What is SHH mutation? Okay, I cannot find it in my list of abbreviations. Okay. Lesencephaly is failure of neuronal migration, smooth brain surface, lacking sulci and gyri. We have sulci and gyri over the surface of the brain. You will not have this. Chiari 1 malformation, downward displacement of cerebellar tonsils through foramen magnum. Chiari 2 malformation, herniation of cerebellum, vermis and tonsils, and medulla through foramen magnum. Dandy Walker malformation, agenesis of cerebellar vermis, lead to cystic enlargement of fourth ventricle, which fills the enlarged posterior fossa. Syringomyelia, fluid-filled gliosis-lined cavity within the spinal cord, damage crossing spinothalamic tract fibers, lead to cape-like loss of pain and temperature. Grist-Man syndrome, lesion in the dominant parietal cortex, lead to agraphia, acalculia, finger agnosia, left to right disorientation. Hemispatial neglect syndrome, lesion in the non-dominant parietal cortex. This is non-dominant. Okay. lead to agnosia of the contralateral side. Clover-Bucy syndrome, bilateral lesion in amygdala, seen in HS herpes simplex virus number 1 encephalitis, lead to disinhibition, including hyperphagia, hypersexuality, and hyperorality. Paranoid syndrome, compression of dorsal midbrain, often due to pineal gland tumors, lead to upward gaze palsy, convergence retraction nystagmus, light near dissociation. Cerebral edema, fluid accumulation in brain parenchyma, increased intracranial pressure, may be cytotoxic or vasogenic. Aphasia, stroke in dominant, usually left hemisphere, in either the superior temporal gyrus of temporal lobe, lead to Wernicke receptive aphasia, or inferior frontal gyrus of frontal lobe, lead to Broca's or expressive aphasia. Locked-in syndrome is a stroke of the basilar artery, loss of horizontal but not vertical eye movement. Loss of horizontal but not vertical eye movement. Okay, this is stroke of basilar artery. Lateral pontine syndrome, stroke of anterior inferior cerebellar artery. They call it ICA. Lateral medullary or Wallenberg syndrome, stroke of posterior inferior cerebellar artery, or they call this PICA. Medial medullary syndrome, stroke of anterior spinal artery. Neonatal intraventricular hemorrhage, reduced glial fiber support and impaired autoregulation of blood pressure in premature infant, lead to bleeding into the ventricles, originating in the germinal matrix, a highly vascularized layer within the subventricular zone. Epidural hematoma, rupture of middle meningeal artery, often secondary to skull fracture, middle meningeal artery, involving the petrion. Subdural hematoma, rupture of bridging veins. So subdural hematoma, bridge veins. Epidural hematoma, artery, middle meningeal artery. Acute traumatic high energy impact, lead to sudden deceleration injury, or chronic mild trauma, cerebral atrophy, increase in age, chronic alcohol overuse, shaken baby syndrome. That's it for episode number 8.